Well, good day, everyone. This is Mark Wolf with Emergency Reporting with the Virtual Thursday training. Today, we're going to review entering an electronic patient care report and our billing export for our NEMSIS 3 product. This recording is actually take 2. For the Virtual Thursday training we had a few days ago, we had a technical glitch which failed to record, so I am redoing the recording, presenting it to you today. Again, my name is Mark Wolf. I'm a regional and DoD trainer for emergency reporting. Want to let everybody know still that we have some upcoming training that will be presented in San Diego, California, May 9, May 10th, and May 11th, 2017. You can check our website for further details and to sign up for that program. Today's objectives. What our students will learn about is navigating the ePCR, entering patient data and information, authorizing the ePCR to complete the incident report, and we'll do a review of the NEMSIS 3 billing export. So without further ado, let's get this started. So here I am on the logged in. We have a home screen. What we're going to do is navigate to the incident, which I've already preset up just to save a little bit of time. We'll go to the incidents module. Select that. We have a call pending. We will select that call and go in, and as I said, we have the ePCR previously set up through the NIFRS report. The missing link today was our EMS module with our NEMSIS 3 ePCR. So I will select that, and we will enter in to the ePCR. Our first step is to add a new patient. And when we enter the ePCR, we got a new look on our NEMSIS 3 product. It's very similar to our standard outlook on the system in the way it works. You can see we have a series of pages over here on the left broken down into the different areas. If we have a red triangle with the red bar at the end, that means we have data that is missing or incomplete. And when we have a green check mark with the green bar at the end of the button, that's our green light, meaning we're good to go there in that section. We have also a little bit of a new look for our required fields. Instead of red font in the title of the field, we do have now the red asterisk, which is a new look and new format you'll be seeing in future upgrades to our entire system. So we started with the incident. It's a typical EMS call. Our NIFRS incident type is 321 EMS call. On basic page 2, let's just jump in so you can see these. Indicated incident type 321 EMS call excluding a vehicle accident with injury. Basic page 2, I've selected yes for a patient care report is required for the incident. Basic page 3, we've entered our incident address and data. Basic page 4, this is one thing that you'll see if your department has the NEMSIS account, is the pane at the top here, apparatus, personnel, and times with PSAP and dispatch notified. Those are optional sections that do not self-populate from your dispatch data currently. And as you can see down below on here, I've got a medic unit assigned, got all the times in on our crew assigned to it already, so that we're good to go with this. Now we're going to move to basic info 5. There's also, when we indicate we have a ePCR, we get the EMS info block at the top of the page that'll open up a couple items that are mandatory with the red font, as you can see there. This was a mass casualty event, yes or no. If I select a yes, then we have several selections that we could make here. This is a single, just a typical EMS call. We're going to say no to that, and we're going to report the complaint reported by dispatch. In this case, we've set this up to be a breathing problem. And down under actions taken, I've noted it as such in the 30 series for my NIFRS coding. 33, provide ALS. And we'll go back into our ePCR. And again, we'll note that anything that's got the red asterisk in front of it, which I'm have my mouse next to right now, that is a required field. Now this is a dynamic validation process as well in this section, and depending on the data input that you provide to the system, you may see other sections of the ePCR module that will now be required, and we'll show you that as we go through the system here. So let's start here with our response and crew. In basic page 4, we've indicated that Medic 101 was the responding unit, so it brings that information over. When I select it, that button will turn to a dark gray color, which means we do have it selected. And that's a common error that folks are making. So as you go through, you have to make that selection and turn it to this gray color. And you may have noted when I selected Medic 101 that primary role of the unit and level of care at the bottom of the screen currently auto-populated, and this is from my vehicle data on my apparatus list. I'm going to indicate that this was the first EMS unit on the scene, and we're going to come down and select the type of service requested. For most of us, this will be the first block here, 911 response to a scene, incident, patient, and disposition. Now we have a chart for patient acuity that, well, we're going to look at that in just a little bit. Let's go down here. We're going to say that we're going to treat this patient and transport by this EMS unit. And here we go. We've got a section for triage if it is a multi-casualty incident for the patient. And down below that, our mandatory section required is our initial patient acuity. Now this, we have basically a chart. Think of this more of a triage, that a critical, a red patient is someone that is in need of immediate medical care or the situation is life-threatening. The emergent or yellow initial patient acuity is that the patient has a medical condition or injury such that if it's not treated, they will become a critical or red patient. And our lower acuity or green is someone that is sick or injured, which does not usually manifest into a life-threatening situation. I'm going to select for our patient today that we have an emergent yellow level for initial patient acuity. We'll move on down to the crew members. You can see on this call I have 3 personnel listed. Michael Bennett, it's who I'm logged in as, Clint Bowling, and Darnell Harris. For Michael Bennett, I'm going to come over here to the memo pad for him specifically and make sure that we have the proper certification level. We're going to put him in as a role as the primary patient caregiver at scene and during transport. We're going to note for the PPE, had the typical gloves on. You have other options under this as well. Gloves, helmet, mask, N95, mask, surgical, non-filtered, reflective vest, so forth, that you can indicate. And exposures. This is exposures to bodily fluids, so forth, and we hope that everybody gets to check next every time for that. And just to save a little bit of time here, that's the only crew member that I'm going to set with that information. I'm going to come down here to the next part of the screen. As you can see, up at the upper left, our response crew does have the green check mark now and green bar, which is our green light all the mandatory fields are filled in. Now it's going to be your department or agency's standard operating procedure or guidelines, however you term them, to determine what non-required fields to provide information as they apply. Now down at the bottom, the delay types, if you do have a delay, a dispatch delay, response delay, scene delay, transport delay, or a turnaround delay, you can note those as appropriate. Now this information can also be captured on the Basic Info 4 page, but in the NEMSIS 3 product, it does not transfer over to the report. So you'll have to select them inside of your patient care report. In this case, we're going to note that we had no type of delays whatsoever for each one of these. Now, again, this will be your department's policy on how to handle this and what information you want documented to it. So I've got everything listed on the page. I've got a green light here, and you'll also note that going through the ePCR, the system will auto-save your selections and data input as you go down through the system. There is no need to push a save button any place in the system. We're going to move on down here to the patient info, and we're going to go through this discussion today in a fairly orderly progression from the top going down, and but you can jump around as you need to as you're inputting data. So we're going to put in our patient, and this is going to be Mr. Jim Shue. A new feature to the system is that we do have the ability to do frequent flyers now. And I'm going to give you an example of that. As you can see, I did populate with a first name, a last name, and a date of birth. When I tab out of this field, and you can see for the date of birth, it actually auto-populates the age and the age units into years. When I tab out, since I've also used this patient in previous calls, we've got information in the system, and I have the option to pre-fill the PCR with that information or to bypass that by saying no thanks. Now we do have, I'm going to select pre-fill this PCR with this information. And we do have a excellent knowledge base article on the frequent flyer system and how that works. Essentially, there's a few things that have to be set up in the system setup. You start building your patient records, you can use this feature, and it will bring some information into the system depending on your previous documentation. The second method of importing a frequent flyer would be to put in a valid driver's license number and a state with that driver's license number and the date of birth, and you'll also get that pop-up window if the system finds that patient previously, and you'll have the ability to auto-populate them. And here's some of the data that comes in. Patient's home address. When you're using that, that knowledge base article will give you pretty complete information on what is brought into the system and what isn't. In the patient information, I have the ability to note that we have medical documents, such as a living will, a DNR form, so forth. We can select that as is appropriate. I'm going to say not applicable in this case. And if you'll note on the module stack over on the left, when we would go down to files and signatures, if I have that document in an electronic format, I can add it to the patient care report under files and signatures, and we will show you that in a little bit. On the bottom part of the patient information screen, we've got the ability to put in contact info, phone numbers and email addresses that you can put as applicable to your patient care report, relative guardian information, and all the way at the bottom, I'll open that up and show you employer information. If it applies to that case, you can put it in. So in this particular case, we're done with that page. We've got a green check mark, green light. We're going to move on to medical history. Now, medical history is one of the sections that, if we have this information in the system previously, it will bring it over into this section. We can note that we, let's say we'll put some patient history in. We obtained the medical history from the patient. We'll note that we had a Dr. Richard Smith was the provider, practitioner. For medication allergies, in this particular case, we're going to come down and say not applicable. And for environmental food allergies, we're going to scroll down to show you this, a long, lengthy list here. And we have the ability to search through here. So instead of searching, I'll filter at the top and just start typing in no. So we have no known allergies. Selecting that, closing. Medical and surgical history. From this patient, our discussion with him is that he is a chronic obstructive pulmonary disease patient, so I will filter the list. And as I type in the chronic obstructive pulmonary disease, the list filters, and I can come down and select what applies to that and close that list. If I have immunization information that applies to the case, I can enter it. And medications, in this case, I'll do so. And I'll show you how we do that by clicking Add New for current medications. We've got a lengthy list here, and again, it works very well to use the filter function at the top of the screen. In this patient, it uses is prescribed albuterol and also Flonase. So I'm going to click Add Another into that medications using my filter again and select Flonase. And on that Flonase, we are going to indicate a dose of 50 micrograms. And through the system, the dosages here, you can see the choices we have. As you use these, they'll auto-populate to the most popular ones that you put in on the left side, and then your full list is available on the drop-down list. And we will inhalation for that. And I'm going to say none. So we captured some data. And on the albuterol, I could have captured the same data for the dosage if we have that. We can indicate if we have alcohol or drug use indicators for the patient. In this case, we don't have a pregnancy. We have a male patient, so we don't note that. But if we need to, we can in last oral intake. So there we have our patient medical history data. And we're going to move along, recording information under patient care. We have a series of buttons at the top of the page that we can work through. We're going to start here with initial assessment. Patient activity. And there's a lengthy list for patient activity. In this case, we're going to have a not applicable because we noted in this case that our patient was sitting in a chair and wasn't active, running, playing, jumping, those types of sports. We're going to indicate that we put a date in for today of last time known well, and we're going to put that about 0700 today, and our symptoms developed about the same time. I could select now, but I am recording this after the time that I put the call in for, since I'm doing this after I've generated the call. If I had barriers to patient cares, I can note that. And if there are none, I can not applicable, select that. Scrolling down to complaints. Okay, we're going to add a new. We're going to enter the complaint. In this case, our patient is the typical COPD patient, so we're going to type in short of breath, and you'll note that when I typed in my first complaint, primary under complaint type auto-populated, and we're going to put 30 minutes is my duration, and anatomic location chest, organ symptom, and this will be pulmonary. We're going to add another because we do have a secondary complaint for this patient of chest pain. And you'll note that when I started typing in the secondary complaint, secondary auto-populated for complaint type, and we're going to put 15 minutes for the duration. So we've got an escalating situation with this patient. We'll select chest for my anatomic location, and organ system is cardiovascular, and click done, and you can see it builds out the list of those complaints, and I can put, if I need to, additional complaints, and they'll be listed as a secondary complaint. We'll move on to the symptoms. Add new, and we're going to type in shortness of breath through the filter. I started typing in shortness. When I got to short, that's the only option I have now. And you can see that that comes up as my primary symptom. And I will add another symptom. And we are going to start typing in chest pain on breathing. Select that, and that will automatically populate my secondary symptom. And we'll leave it at that. And we'll move on down here to my impressions. To my impressions, I will add start typing in COPD, and it is filtered down through respiratory, and we'll select that, and it will auto-populate with my primary impression, and I can say done with that. And we have a pretty good record of the initial assessments here, so we'll click done. You can see it builds that out, representing on the table, sorted by the date and time. So now we'll record the vital signs for this patient. So we'll move on to that section. And you'll notice through here that where the date, time, vital signs taken, and we'll see this for the exam, procedure, and medications as well, is that we've got the ability to timestamp this. The date of the incident report will be presented here in some times, and now this is our arrival at the patient time and our in-service time. So our times that we put in here have to be between those two times. So we'll go in here and select the date. And in this case, since this was later than I put the incident report in, I will type in the time that we took our vital signs. In this case, we have 3 members on the crew for the Medic 101 that's at the scene. So we can select which member of our crew took those vital signs. In this case, I'm going to select Clint Bowling as that member. My whole entire list of my agency will be presented here as well, that I can filter down and go grab them as well, if that's the case. We'll note that we had a supine patient. We're going to put in some typical vital signs that we might have. Palpated a regular pulse, elevate a little bit of 110. We're going to move over here to the left and put in some blood pressure readings here. We have 150/98 recorded. The method of that measurement, manual auscultation. Respiratory rate we're going to enter for this patient is going to be 24, and shallow. Our end tidal CO2 reading we obtained was 32. We did not do a carbon monoxide reading. Pulse ox, we put in a value of 89. And we're going to go down here. We have options if we have a stroke case to note that. If we take a body temperature to note that. In this particular case, we are going to note that we did an EKG. And we're going to manually interpretate a rhythm. And we're going to note that we have a sinus tachycardia, right? That we 12 lead right-sided, and we've got our vital signs in, so we are done with that. So you can note that we have this here. Now you can take additional vital signs and note them into the system by, if you're doing them all at once, add another, or we can just come up and select vital signs again, and we can go to that window and enter the data. Let's move on to the exam. And again, we have our times up at the top that we have to select and keep our mindful of our times between the ranges that we had contact with the patient. We're going to select under mental status. We have oriented ×4 here, person, place, event, and time. Our neuro assessment, we're going to note that that's normal, and we're going to filter that out. Normal baseline for patient. We don't have any stroke or CVA symptoms to note here. Skin assessment. We are going to note that we have a diaphoretic and, I'll just scroll down here to pale. Skin assessment. And our eye assessment, we'll get down here for this patient, our typical COPD patient. I'm going to say bilateral, come over and say reactive. No issues here. Chest lung assessment we'll get to next. We'll pick down through here. So we're going to select, now that we have breath sounds decreased left and right, and we will come down. We can put a spine assessment and abdominal and extremity assessment on this patient. We do want to note that, so we're going to add a new, and we're going to select ankle left, and that is going to be a little bit of edema has set in. And we will add another ankle right with the same result. So we've got that noted into the report. And if we need to, we can go down here to the bottom to our pelvis assessment. Select none now. So we'll come down and show that we've got our initial assessment, our vital signs, and our exam noted. Now we're going to go into the procedure section. I want to note that the procedures in the system are set in the admin to the certification level of your personnel that will note here performing this procedure. So we'll note that we did not have the procedure performed prior to the unit's EMS care. Again, we'll note the date and time between the ranges. And we're going to put down that Michael Bennett performed the procedure. And you can see that the certification level automatically populated. Now, it may take a second or two for that to do that. In our case, we have a standing order system. We're going to select standing order protocols. If we did call in for a verbal order on that, we would note the procedure or the protocol procedure authorizing physician's name here. So in this case, we're going to put in here in this particular case that we performed a 12 lead ECG, and we have size of procedure equipment in this case really does not matter. We have one attempt, and our procedure for this really isn't applicable. We didn't have any complications. We can note that if we need to, and what's mandatory here was that procedure successful, and yes, we successfully applied the 12 lead ECG. And in this case, we're going to add another because we did start an IV on this patient. My time in, Michael Bennett performed this as well. We have him as a 2009 paramedic. Again, this is a protocol, so we don't need to put in our procedure authorizing physician. So our procedure is vascular access, vein extremity. And we're going to have that location of that in the hand left. In this case, we do have a size for our procedure equipment. We use a 12 gauge and one attempt. It's really our, in this case, we were doing a TKO line. No complications is what I would note on here. And was the procedure successful? Yes, as well. So we're done with those procedures. And they're listed right here. So we're going to go on to the medications. So for this patient, we're going to have it was not applied administered prior to the EMS unit's care. We will select our date, enter our time. See, we've got that warning that pops up as I'm populating that. It was doing the calculations for me. In this case, I'm going to select EMT Harris as our personnel using the medication. Now, what I want to point out here is that this list for an EMT on medications is quite a bit smaller than the paramedic list because we set that up in the admin section. This is administered per protocol. And here's a very small list of some of the things that we have locally here. And I'm in Ohio, and we have some very detailed protocols. So we're going to select oxygen, and a frequent medication administration does display here for that of 2 liters per minute inhalation. So when I select that, we'll see that it auto-populates everything down below, and I just double-check that to make sure it's complete. And we'll say that the response to the patient's condition improved. We had no complications. And we are going to add another. We are going to have our paramedic, one of our paramedics, I should say, on the call through a protocol, administer an additional medication. Now, this medication list, as you can see, has got quite a few on it. And in the system here, what this will do is your frequently provided medications will populate here that you can select, but your entire medication list will be available, and this is defined in the admin section, and it's quite lengthy. And this would be customizable for your agency in that section in the admin module to what you actually administer. In this case, we're going to select albuterol, And this is going to come up with the frequent medication administrations as well. 2.5 milligrams. We'll select that and it'll auto-populate down below here. And we'll medication result is the patient's response was improved. And we will note that we had no complications again. And we can add other medications in. I'm just going to shorten the discussion up a little bit here for the purposes of training. And you may do frequent or additional medications through the course of patient care. And you can note those out and they'll save to the page. And down here we have the medication with the oxygen and albuterol and so forth. And in a particular patient, a COPD patient, we may be able to or need to provide additional medications. Okay, we're going to move on to the event page. Now you see this auto-populated with this green check mark. Now this can change depending on the data input you have. This is pretty much of a medical case and not a trauma case, so we really don't have anything at this time we need to put in. I can select my protocols, and this is again a list that can be customizable in the admin section on the protocols that your agency provides. In this case, we're going to note that we have we'll come down the list here. General IV access, for example. And that's a general protocol. We don't have it split into pediatric and adults. And I can add other sections as we go through by selecting add another and go down to my other I started typing in airway. So here we have medical respiratory distress, asthma, COPD, reactive airway. We'll select that. The general, and we'll say that we're done here. So you can note what sections of your protocols that your care comes from. On the event page, we also have injury. If we do have an injury, it'll auto-populate to unknown by default. I'm going to say no, we did not have an injury. Now if I did here say yes, that some of these sections down below here will become mandatory at that point. You'll have to put information in. And down below that, we have the cardiac arrest section. This by default will come up to no. If you select yes, then again, additional information will have to be provided into the system down here to document the case. Then at the bottom, we have a work-related incident if you need to note that. In this case, we're going to move on to the destination. And the destination became red here that we need to put data in because we noted up in the response and crew that we transported the patient. So it automatically noted that we have that patient information to be transferred down here will be transported. So we're going to select emergent yellow in this case. Patient transported by EMS unit. Now you can see that some of these are not required. So it's going to be up to your local protocols and how much data you want to capture to put that in. Our transport mode in this case, we're going to say is non-emergent, which would be pretty typical with the stabilized patient. Our destination name and location. In this case, we're going to locally, we have a facility called Wayne Healthcare that I've got pre-populated into my destinations in my admin module, and you'll see that information for their address will self-populate here because I've got all of that in that field. Now, one I will mention specifically is the destination county. In the setup of this in the admin section, that's not a required field, but if you do put the data in and spell it correctly, including capitalizing the first letter, it should auto-populate for you. So you can do that. Reason for choosing the destination is required. In this case, it's the closest facility. My type of destination, which is data I previously put in, will populate here with and be selected for hospital, emergency department. We can put in, did we do pre-arrival alerts? In this case, we said no. So we're going to leave it as such. And we have the ability to enter, if it applies, emergency department destinations. And our hospital destination, what is required is hospital. That auto-populates again and selected because of data we have in the admin section that we built out for that facility. The next section we're going to move to is the billing section. And you can put in a lot of information here. What we are going to do is show you a few of these things, insurance company names, and this will be your local policy and practice on what you need to have in here. A lot of agencies do not put this information into the ePCR and allow their billing company, if they use one, to do that. We're going to come down to the response and transportation section here, because that's typically an area where your response crew is going to have to enter some data. Response urgency, in this case, was immediate. Do we do ALS assessment perform? Yes. CMS service level. Again, this is local policy and practice. Select here, we're going to say ALS level 2 on this case. Our transportation indicator. And we are going to select, we had IV medication required en route, and you can pick up the other ones as you need to and enter that data. Our condition code, and we can select that. Pretty long list. For time expediency, I am going to leave that one blank for today. You can come down here to the really important ones for us is typically our mileage. Now the system will put in mileage if you get a beginning, on scene, and destination mileage, or we can just type it in because we've known that in this particular community, 2.5 miles. And we can note what supplies we use down here as well. Type it in, how many times we did that, and enter that data as well there. So we've got that information in for billing. We're going to move on down to files and signatures. Now this is where if I had a document I needed to scan in and add to the record, I can add that by selecting add file here. And this works just like every place else in our system to add a file. Seek it out on your computer and then add it. On this particular case, we have the standard HIPAA form, and you may have more than one form. And the forms that are required on a ePCR are determined off of the disposition under response crew, and that is set up in the admin section. And you may have more than one particular form here. I've got a HIPAA form. In here you may have a transfer of care form, patient belongings form, and if it was a refusal situation, you may have a refusal form in there that would need to be filled out. And these are all done electronically in the system. I've got my top of the form, I've got a disposition or description of that form, and in here you can see I shortened it up quite a bit. I provide all my language, legalese, and information on here for the patient to read. I would note it that it's a patient, or I could say the patient representative signed it. And I'm going to do my best with using my mouse since I'm on a PC. Move on down. I can select the signature status in the event your patient can't sign the form. Select that proper one. And I'm going to come down to the crew section, primary care provider, which is going to be me. And then I will come down and I'm just do my famous signature. Click next, and you'll note that now I get a green check mark for my HIPAA form. So we can move on. You may have, like I said before, more than one form to fill out depending on how that is set up in your system. My next section to come to is my narrative, and a narrative gives us a text box that auto saves. That's my typical line I put in for this is my narrative. I don't write it down. I didn't observe it or do it. So this will be based upon your needs for that particular patient care report. Some of these can get quite lengthy, as you all know. Don't really know to go into that any further. You can review a request by clicking yes down here. It's optional. And you have your registry patients information down here at the bottom. In this case, we don't really have any, so we're not going to note that. Got our narrative done. You can do a copy and paste here as well, and I will point out to you that this narrative auto-saves every 20 seconds, just like in our NIFRS report. So we're about done here. We're going to move down to the summary. And we have the ability to come down, scroll down through here and review our report before we authorize it. Make sure we have all of our data in. If we need to go edit something, we can jump back in and edit it. Here's all of our medications or events, destination information, billing information, file signature, or narrative will be presented here. When I get this done, I can go in and authorize by entering my password. Click authorize, and there we have a patient care report green light. In your EMS module, I've already pre-filled out narrative files or custom payroll and so forth, and I will go down and authorize the incident. And there you have the basic lesson in providing the data for an ePCR. I'll reset this to completed calls, and that will be right here at the top. Now it's ready for my QA, or what other term, CQI, whatever you may use locally. Okay, now we're going to give a little discussion about the a manual billing export from NEMSIS 3. What I've had to do is go in and log into a different account. So what I'm going to do is when I get into the account, I'll go on my first step after logging in is to go down to the administration module, select it. I'm going to navigate over here to NEMSIS 3 medical billing export, select that. I'm going to come up at the top and click update here for my export, and I'm going to get this screen. Now, I set this up before to have a patient care report that needs to be exported. So we have 3 sections here. We can generate an export file at the top. And one thing I want to point out, and I'll highlight this here, each file, then when we generate an export file, will contain up to 25 patients. And that is set currently at 25 patients so that we manage a reasonable file size in the system for exporting. So if you have, or if you're a busy agency and you have 50 to, let's say, 100 patient care reports ready for exporting, you'll have that number down here at the bottom of what you have available. And you will be doing no more than 25 at a time. So you may need to do this multiple times depending on your agency's needs. The next box down will be you can export them by an incident number. So if you have the need to put out a patient care report for billing by an incident number, you can enter that, generate the export file there, or the bottom box will allow you to export that data by a specific patient care report number in that case. So what we'll do here, this is a fairly simple and straightforward process. A lot of the information that you need in your agency for generating export files and what happens to them is done behind the scenes. And we'll just select here, generate the export file, and the export file will be generated. It may take a few moments for it to do so. And now we can click, we've got our hyperlink down below here to click here to view the file. Right click and choose Save Target As to save the file. In some cases this does send it automatically to your provider. Now you can see at the bottom I generated a zip file. This case I'm going to open it. And in my case I'm going to have it available right here. And then we can do what we need with the particular file. Again, this is all set up behind the scenes, and you'll be able to direct that where it needs to go. And there will be soon the ability to automatically generate a billing export if it applies to your agency. Then you won't have to come in and do them manually in that case. So I'll be looking for that into the future. And that's about all we have on my take 2 for completing a basic ePCR, NEMSIS 3, and a short discussion here on how we do our billing exports. Have a good day.